or compensated, uncompensated. That's it. So 7:45. Be quiet. Listen. So I can do it. 7:45. If it's alkalosis or acidosis. 49. Is that up or down? Up. Right there. Because I got that, I don't need to look at nothing else. Because I'm able to answer it. We ain't there yet. We ain't there yet. It's metabolic. I don't need nothing else. It's metabolic. Now I want to know if it's uncompensated or compensated. Right? I look at my pH. My pH is 745. That is considered compensated. Because in y'all language, y'all call it normal. Same thing. So it is compensated metabolic alkalosis. You see it? Anybody else with any numbers? Any number you have. Simple. All I did, you use the rule. You remember Miss Sonia said, do you need, somebody asked, do you need the third one? No. And anytime you have a third one can be 1 point off, 1 point big, or normal. Long as you got 2, you should be able to answer the question.
I have a number.
Yes.
pH.
Huh?
7.40.
7.40.
CO2.
24.
CO3.
Let her talk. See if she coming up with these numbers. CO3.
55.
CO3 55. That would never happen, but anyway. All right, we'll do it. So 740, right? That is within the range. 740 is considered acidosis. Down. CO2 is what? 24, which is what? Down. 2 arrows going down. What's my name? Metabolic. Be quiet. Metabolic. Stop right here. Metabolic. True? Are you good? Now, est-ce que vous écoutez me joindre métabolique là? Now, I want to know if it's compensated or uncompensated. So what are you going to look at? pH. pH 740. So what is that, ma'am? Compensated. Now, I want to know if it's acidosis or alkalosis. So I'm going to look at what? pH. So it is compensated metabolic acidosis. Yes, it's not that they will not give you CO2. They will make CO2 normal.
And when it's normal, then
You tell me. Look. If CO2 is 45, if CO2 is 45, watch this. It's a good question. I love it. So you're going to put N. What's 55? What's 55? Can you name it? Can you name it? Shh. Do you have an opposite, miss?
yes.
So what is my name? Stop. Respiratory. Why is it respiratory? Because pH is low, CO3 is high. It's the same guy. You're trying to put in. I understand, baby. You can't get me, baby. This real here. We giving me numbers to see if it's gonna come out. Comprendre. I'm not memorizing. So I said, bon, comprendre. That's why I keep making sense. Real comprendre. Quand déchiré, mettez à terre, ouvert, large, whatever. It's still the same. You can give me one. No, every number your heart desire, it still will come out the same if you understand the rules. Okay? You tell me. Where's your number? Here. What is it? Compensated or uncompensated? Why?
Because the
pH is within the range. There you go. Yes.
Okay,
Keep it simple. Yes.
for the pH,
Go ahead.
okay, you said that when it's from the 34 going down is the acidosis. When it's 46 going up is alkalosis.
Yeah.
But you have the pH there 40 and it's from which number between the range that is acidosis or alkalosis?
From 734 on down. Some book will say it is acidosis from 44 on down.
So
Some book will tell you from 44 on down is acidosis, or they will consider 735 acidosis. From 744 on down is acidosis. But you got to be careful because you got to explain to the student why. Because you're going to say, well, Miss Sonia, why would you say 745 is normal, but then it's acidosis? Because it's all the same thing. From 744 on down, say acid. Yes.
Since the CO3 is 55 and it's 22 to 28, would that be alkalosis?
Wait a minute. Anytime we say alkalosis, baby, we don't look at CO3. We only look at the pH. You look at the CO3 and the pH to name it, whether it's respiratory or metabolic. Anytime I want to know if it's acidosis, alkalosis, just got the pH. When I want to know whether it's respiratory or metabolic, I look at everything. That was a good question, Susan. That's the problem students have. You don't know which number to look at. So let me write that down so I can clear up that. Because that's a good question she asked. I'm going to erase this because I think y'all got that. Susan asked, what do I look at to make a decision? Right? So anytime I want to know if it's acidosis or alkalosis, right? I look at what? pH. Not only for acidosis or alkalosis, but also if I want to know compensated or uncompensated, I look at what? pH. I think that'll help y'all. Now, if I want to know what's this name, respiratory or metabolic, I got to look at the pH and CO2. If I want to know whether it's respiratory or metabolic, I look at what? I look at pH and CO2. If I want to know if it's acidosis or alkalosis, I look at pH. If I want to know if it's compensated and uncompensated, I look at what? pH. If I want to know if it's respiratory or metabolic, I look at what? pH. That, if you don't understand it, I can't talk no more. Any questions? Now we cool? That was an excellent question. That was a student question that the light bulb just went off. She just said something deep. Okay? Any question? Who still don't understand? Who don't understand nothing I did on the board? No, be honest, because I can see it in your face. Trust me, some people today is your first time doing this. It's okay. Who don't understand nothing that I'm doing? Okay, if you don't understand this, next week I'm giving this Wednesday in the night class. So at 6 o'clock, so you be there to get it again. If you didn't understand this, there's no way you went to open the Pearson door at all. No, don't laugh. If you don't understand that, they ask a lot of questions. And we haven't got half of it yet because we haven't went to the disease. Which disease fall under what? Where police problem. You got the numbers, now we got to talk about the disease. Any question? All right, I need to erase the board.
Miss Sonia.
Yes.
If pH is 40, 46, and CO2 normal or CO3 normal, like how would you make that?
You tell me from what I taught you. Let me erase the board. Let me erase the board. I'm going to leave this. I just want to erase this so I can put the disease. I want to answer it because it don't make sense and you try to make stuff difficult, which is not. But I'll show you why it don't make sense and you'll figure it out so it can clear. You just, guys, you can't believe it's so easy. You trying to add more buffet pizza if I say ça. Guys, nursing not that hard. Keep it simple. Right? But I'll show you when we go on break.
Okay.
Because I think some people might find it hideous, so I don't want to. All right, respiratory acidosis. Miss Sonia already taught you the numbers. So NCLEX asks you, yes.
Can you tell the people behind me to stop talking?
Okay.
Because I'm about to lose it.
Guys, look, please, I know when we learning new things, people get crazy, but you got to understand people taping. Keep it down. If you don't understand, you remember I'm doing it again Wednesday at 6 o'clock. Don't ask your neighbors. Trust me, your neighbors don't know what they're talking about. You need to come and ask me later on after class. Don't ask your neighbor. Mommy, you probably want to, I know you're taking note, you can't see. Maybe you want to stand there. Guys, let's just keep it, right, fun for everybody, not be so loud. I know you're excited. I understand that. Right? But please, let's keep it cool for everybody. Okay, when you are respiratory acidosis, it is a medical emergency. So nurses, you gotta know that. So, now, it's medical emergency. Anytime you respiratory acidosis, right? Anytime you respiratory acidosis, it has something to do with airway. Like, remember Michael Jackson took all this medication, his airway went down? So let's go to box, page 92, 10-1. And I want you to circle asthma. Circle asthma, right? So it's box 10-2, right? 10-2. 10-1, I'm sorry, 10-1. I want you to circle asthma. Page 92, 10-1. Circle asthma because I'm going to talk about asthma. You see ataxia, which is what? Lungs collapse, brain trauma, bronchiolitis, bronchitis, CNS problem, emphysema, COPD, hypoventilation. Let me explain something to you. When you have asthma, early asthma, you wheeze. That's good. Asthma, wheezing is good. That is called hyperventilation, which is good for asthma. When you stop wheezing, asthma, that is called hypoventilation. So early asthma is respiratory alkalosis. Early asthma is good. It's respiratory alkalosis because you wheezing. So some air coming in. Late asthma, which is called hypoventilation. Look, I'm no air. That's a medical emergency. That is respiratory acidosis. So again, early asthma, wheezing, that's good. That's good. They call that hyperventilating, and that is called respiratory alkalosis. Late asthma, meaning you stop wheezing, you stop everything, that is hypoventilation, that is a medical emergency, that is respiratory acidosis. Anytime you have respiratory acidosis, nursing intervention, position the patient, right? Give oxygen, call the doctor ASAP. That will be a patient you will see first. Respiratory acidosis is bad. Now, you remember we did EKG? I talked about a drug called what? Amiodarone. And I said, anytime you on amiodarone, what must we check? Respiratory. So anytime you giving amiodarone, which lab you see the doctor order? ABGs. Because amiodarone give you respiratory acidosis. And they go the NCLEX question. You given amiodarone, which lab you will do ABGs? Or they can say which lab, or they say or they'll give you 4 sets of ABGs. Which one a patient taking amiodarone you will call the doctor? They will give you, the patient is taking amiodarone. Epiabau labio, pH, CO2, they'll give you 4 sets of ABGs. Which ABG you looking for? Respiratory acidosis, means pH is down, CO2 is up. Who did not understand that? Let me put it on the board. They will say, the patient is taking amiodarone. Which lab you will see will make you call the doctor? Got it? pH 704, pH 749, pH 735, pH 745. Now did we? CO2 55, CO2 30, CO2 45, CO2 35. It's even wet. Now, which lab? You see that? A. I see a lot of eyes, but if you just didn't understand what I did, your problem just started. Because amiodarone causes what's problem? Which ABG tell you there's a respiratory problem? There you go. 704, so that means pH is what? Down, CO2 is what? That is what? So that is what called respiratory acidosis made in NCLEX. Or they say, hey, the patient took morphine. Oh, the doctor ordered Narcan. Why doctor ordered Narcan? To reverse the respiratory. They can give it to you words or numbers, or the drugs, or the disease. What you want, what you want. So I taught you numbers, and you need to know all the disease that fall under here. And they're all lung disease. Any question? We good?
Yes.
Now, any question? You see that? Huh? Make sure. Now we go to respiratory alkalosis. Now this is where the patient, you may have problems. So look, on NCLEX, watch this. The patient is taking cromolyn. What is cromolyn used for? Asthma. Right there. The patient is taking cromolyn. The patient has difficulty breathing. Which ABG you will see? Give me the ABG, the name. Respiratory Acidosis. Acidosis. Because the key, I said the patient has difficulty breathing. So that is what type of asthma? Early sign or late? Late. Be careful with that. They get you on those questions. You got that? Now, respiratory alkalosis. We're going to go to box 10-2. Oh, stomach, I made a little Google. 10-1. Pardon. 10-2. Now, watch this. Right? Ready? Anxiety. Y'all just finished psych with me. Which drug I give for anxiety? Xanax. There you go. The patient is on Xanax. Give me the ABGs. Respiratory. I can give you the disease, the numbers, or the drugs. What you want, what you want. You see that? Your book say anxiety. NCLEX remove the anxiety. They give you the drug. I can give you the numbers. I can give it to you in drugs. I can give it to you in word. Or I can give it to you sign and symptoms. Okay? Fever. Okay? Right? Hyperventilation. That means early what? All right. Hypoxia. So, where did I teach you hypoxia? I taught you hypoxia where? Neuro? Parkinson? No. I taught it to you fundamental. Pre-op, post-op, last week, the week before that. I taught you hypoxia is a complication after surgery. So they ask you, after surgery, the patient had pH, right? High, right? CO2, low. What is that? Respiratory. This is where the people get you. They take fundamental, go away. Where did I teach you hypoxia? On page 192, complication after surgery. I told you the complication after surgery was pneumonia, hypoxia, constipation, paralytic ileus, evacuation, dehiscence. Come on, people. Right? So they give you hypoxia and ask you the ABGs. Hysteria, oxygen, overventilation, pain. The patient just had amputation What ABGs? Be careful. I'm in pain. What's my ABG? Respiratory Alkalosis. When you give me the morphine, you put me in respiratory acidosis. NCLEX question. When I'm in pain, I'm in respiratory alkalosis. When you give me morphine, you put me in what? Acidosis. No, but the Xanax is respiratory alkalosis. Xanax is not for pain. Xanax is for anxiety. No, but Xanax calm you down, but Xanax don't put you in respiratory depression. Xanax is what we call has anticholinergic effect. It make everything down, but you cannot tell me Xanax make respiration go down. Xanax make everything go down. Ça vient avec bon comprendre. But morphine make respiration go down. You got it? That's why when you go to NCLEX, you take a Xanax pour arrêter devant le computer comme ça. Any question? We cool? Huh? Ah, good question. Now, LPNs, watch this. When you give first of all, what is albuterol? Bronchodilation. Stay with me. When you give albuterol, what is the first thing it make the patient do? Anxious. So heart rate go up. So albuterol make you respiratory alkalosis. Yes. No, same thing, because Percocet, morphine, tout ça, didn't work on the respiration. But vous pas qu'à dire Xanax travaille respiration. Xanax make everything go down. Yes. That's going to make CO2 up and pH down. Shh. Be quiet. Okay? Any question? Okay. Then we go into metabolic acidosis. Ooh, I love this one. Box 10-3. I get you hard on this on my mama, papa, and NCLEX get you. Look at diabetes mellitus. Y'all see that, right? So when the patient is diabetic mellitus, they metabolic acidosis. NCLEX, they would not put diabetes. They can give you a sugar. They can say metformin, or they can say insulin, right? Or they give you an A1C, whatever you want, and ask you, what's the ABGs? Well, Bugla say diabetic. Give me more English to tell you that the patient diabetic. I can give you a lab value. I can give you an A1C. The patient taking insulin, the patient taking metformin. Solvely. I'm saying the same thing. You going to go the way you study. Let me memorize. So diabetic patient is metabolic acidosis. They flip it on you. They don't put diabetic. They give you lab. Right? Now, then excessive ingestion of aspirin. Right? GI fistulas, high fat diet. Oh, I love it. The patient is on Lipitor, Zocor, or they put HMG-CoA. That's the class for Lipitor, Zocor, Mevacor. Metabolic acidosis. Guys, I could give you the drug, I can give you lab. Or they give your patient cholesterol. What's the total cholesterol? 200. Suppose I give you a 210. That means the patient is what? High fat. And that is metabolic what? Acidosis. The problem with the students, I don't want you just go study this. High fat. No. You need to understand. Lactic acidosis. Can I ask you a question? Which class I taught you a malnutrition patient? Psych what? Anorexia. Or psych what? Alcohol. The patient is an alcoholic patient. Give me the ABGs. Metabolic acidosis, because when the patient alcoholic, they are what? NCLEX. Guys, you see the critical thinking? You got to comprehend. You got to understand. If there's nowhere in the book, I say alcoholic patient. But all I'm going to put on your test, and if this is on one of my psych tests, hell, you might get it next week. I just gave you the answer. An alcoholic patient always what? Malnutrition.
So also anorexia, bulimia.
Of course, they malnutrition. You see that? Okay. Severe diarrhea, starvation, anorexia, bulimia. You see that? I'm trying to teach you guys. Don't just go on NCLEX like this. Not this NCLEX now. Okay? Donna, a Jamaican lady, graduated from FAU, a Kuma Malata. What is a Kuma Malata? The top 4.9. She had so much chords blocking like Mr. T. You know Donna went to NCLEX and didn't pass the people test. She couldn't even show her face at FAU. Big Akuma Malata, they name them big name. She had so many chords. She graduated 4.9. Donna went first on the people test, failed. FAU said, don't bring yourself here. You bring my school down. Donna came here fast. She stood up here and told her story. Because I do talk a lot, but I didn't want to tell y'all she was FAU valedictorian. She went and she failed. She failed. Donna never had B. Every class. Fall. Donna read this book upside down, but Donna didn't understand. She came here, she went, she passed. Then she can show her face FAU, but it don't count. The school already lost the point. They were so mad at her. She said, Miss Sonia, I can't show my face. I said, no, you can't go show your face. You failed the people test. You see that? It's not about how many English you speak. You speak good English. It's all about understanding. That's why y'all get mad when I don't take the answers you say. It's all about understanding. I promise you. If you don't understand, you will fail this test. Not one time, twice, 3, 4, until you change. It's all about comprehend. Don't go what the books say. The books say something, but you got to understand what the books say. Okay? So don't trust me. Students don't intimidate me with all that good damn English. That don't intimidate me. Right when stuff come out your mouth, things don't come out right. Hey! Stop it. Give me good comprehend. Then we can talk. Not that don't faze me. Alright? It's all about understanding. Okay. Any question? Renal failure. NCLEX can put a dialysis. NCLEX can put BUN and creatinine. What is that? Metabolic what? Acidosis. Renal failure. Dialysis. Yes. Or they give you a lab. Know your lab. RN. Know your labs. They killing y'all with labs. Labs is on page 100 in your book. Also in the skill book. Know your labs. Turn. Metabolic alkalosis. Right? Take a break. When we come back, we will do this. Take a break. Go eat. Break mean Miss Sonia break. Break. Unless you dying.